Izzy Steer recognizes the importance of having the right team. Like when she tore her ACL in her left knee during her senior year of high school, and still had an offer to play basketball at the University of Wisconsin Stevens Point.
And they were pretty much my top school that was like, we don't care, we still trust in you, we trust in your abilities.
The standout guard from Hawley, Minnesota also had a team at Sanford Orthopedics and Sports Medicine in Fargo, North Dakota.
It's way more than a knee injury, right? Like, this is these young athletes' way of life. It's what they do. It can be very devastating, and fear of re-injury is one of the biggest reasons athletes don't get back to sport.
Steer returned to the court for her first practices as a freshman with the Pointers last fall, when a twist of fate shut things down.
She was just doing something that she's done a bunch. She was just driving with a jump stop and a finish. It actually took place in the corner right over there.
And I immediately felt my knee pivot in, and I knew the feeling right away.
Steer had torn her ACL again, this time in her right knee.
I did think about my family right away. I'm far away from home. This is going to be tough.
Unlike her previous injury, Steer was 7 hours away from home, but that didn't change who she wanted on her team.
I went back home because I was familiar with him and with his work, and so I trusted him to do it.
Dr. Noonan reconstructed the ACL in Steer's right knee, repaired her meniscus, and added what's known as a Lemaire procedure.
And that's a lateral procedure on the knee where you take a little strip of her IT band and you fix it to the femur. What that does is that fights that pivoting or that rotational motion. It's been shown in really high-level research to dramatically reduce the risk of re-tearing an ACL reconstruction, especially if you use a graft like a hamstring.
Another repaired knee under her belt, Steer had a familiar journey ahead, both physically and mentally.
Doing it the second time, I honestly think it was easier this time because I knew I can get to the other side, but it's harder right away knowing that you do have 9 months to a year of just working and working and working.
She also had another teammate to lean on. Marshfield Clinic and UWSP have a partnership that includes 7 full-time athletic trainers, offering a full approach to sports medicine.
Just being there for them every step of the way, because it is an emotional roller coaster for somebody who goes through that. And just being there to hold their hand on days that they need to be held and other days where you just need to push them and tell them, let's get this going.
Another partnership also helped ease the burden. The integration between Sanford Health and Marshfield Clinic meant Steer could see a doctor near Stevens Point for follow-up, and she didn't have to make the long drive home.
It was nice knowing that I could drive 30 minutes here and go see somebody.
It also helped to better streamline her physical therapy.
I like to be a part of those conversations when they do meet with physicians, because there's little things that athletes may not pick up on that a physician says that kind of guides the trajectory of rehab.
Yeah, I think the team approach is the only way to do this appropriately. And it is, one of the things that Sanford can do so well.
Steer passed her return to play testing at the 6-month mark and is on track to rejoin the Pointers on the court this fall. Her teammates behind the scenes are excited to see her return too.
So, I love it. I just think it's a privilege and an honor to help take care of these young athletes, going after the dreams and things they worked their whole lives for.
When Steer does check in for that first game, she'll know she has a strong team behind her drive.
It feels great, knowing that I can do everything that I've been taken from for about 2 years now.
With Sanford Health News, I'm Justin Wolf.
It's going to be a great feeling.